Good morning, everybody. Good afternoon. Welcome in whichever part of the world you're in and in whichever part of your house you happen to be in for most of us who might be on lockdown. My name is Colin Andrews. I'm going to be the moderator of today's discussion. I believe we have close to 100 people already in attendance and already logged in. And that number seems to be growing by the second, which is great. Just a little bit of a word of introduction. If we could move to the next slide, Karine. What we'd like to do today is open up the first of a four-part webinar series hosted jointly from socialprotection.org, as well as the Partnership for Economic Inclusion. I know many of you might have been engaged in the partnership before, and this is the first of our formal webinar series, which we had planned a little bit before the COVID-19 response, but it seems all the more urgent to do it and to fast track it these days. So before going into today's seminar, please note and save the dates for a few more seminars that will follow. The idea of these seminars really is to showcase first-hand country experiences in the implementation of economic inclusion programs. And during these sessions, we will certainly touch and ask to touch on issues around the COVID-19 response and what that might mean. A little bit more on that later. Over to the next slide, please. So in today's session, we'll cover a little bit about the Adaptive Social Protection Program in Sahel. And just before maybe introducing the speakers, this is my first time on socialprotection.org. I'm amazed and impressed with the technology for hosting these webinars. But for those of you who are new to the facility, everybody is muted at this point since we have so many people. I think there's 120 attendees now logged in. What we would do is we will pass over to our panelists who I'll introduce in a moment, and then we'll take questions virtually. So what I would like you to do is to start thinking, and as we go along, put questions into the chat box that you have, submit questions, and we have a team of magic elves working in the background to figure out what would be the best responses and questions to raise, and as moderator, I'll do my best to give those to you. So we have two really fantastic panelists today. If you can just go to the next slide, please. Karine. First, we've got Thomas, and Thomas is based currently in Senegal. He's a colleague of mine at the World Bank. He's based in the Africa region, and I will let you read his very impressive resume that's already up there. But I think what's quite interesting about Thomas, he brings quite a diversified professional track record. He's a very deep and thoughtful thinker. So he's one of the people who is really stopping in his operations to think a little bit around what's working, what's not working, and how you course correct this. And in the work of the Sahel program, he's doing this really at tremendous scale with a whole team of counterparts and people across different organizations. So we look forward to hearing from Thomas. And welcome also to Yéréfolo. On the next slide, please. And we're very pleased to have Trickle-up as participating in this session, and I think this is an important reflection of some of the partnership aspects which are so important as we move towards looking at economic inclusion more broadly. And he's also got a very impressive resume, which I'm not going to go into, but one thing that did caught my eye was that he's trained as an engineer, and I always find these things very fascinating because it's so important to have really different perspectives, mindsets to come into these discussions, so we're not all seeing things in the same way. So welcome to you. And we do have a couple of other panelists or folks from Trickle-up, including Joe Swanson and Barbara, who are available should we have some internet connection problems. Now, before passing over to Thomas, I can guarantee you one of the big questions here will be around COVID-19 and what does COVID-19 mean in terms of the crisis and how we start looking at economic inclusion programs. And I personally see this as a double challenge. Certainly at this point in time, we see programs which are at risk, in jeopardy, because social distancing is so much striking to the core of economic inclusion programs. So what adaptations will countries be making? But at the same time, we would expect that these programs could be up and ready and in motion 6 months, 9 months down the road from now to participate as part of an integrated livelihoods recovery strategy. We don't have all of the answers on these questions that many of you will raise today, but what we will do in the course of this seminar, we're circulating a survey monkey. So I'm asking Karine at the start of this session, and you can use the whole session to fill out the survey monkey as you're listening in and out and sometimes doing other things. There are 3 questions on that survey monkey which really seek information from the country level and which really seek information from global experiences to try and capture what you are thinking. And from the Partnership for Economic Inclusion, we're trying to at least bring this information together, identify what's happening around the world in different countries, so we can pull together information and bring it back to this community in a meaningful way in the next number of weeks. So hopefully you will be able to see that survey monkey coming in, and I'll ask Karine to magically take care of all of that. I think if you look in your chat box, it should be there. And if it hasn't arrived by the time Thomas finishes his presentation, we'll make sure to recirculate that again. So with that lengthy introduction, what I would like to do is pass over to Thomas and then directly on to Yéréfolo afterwards for his discussant remarks. I have told both panelists that their presentations will self-destruct after a rigid time period. So Thomas, I will be coming back after 25 minutes and pressing the mute button and Yéréfolo will discuss for about 5 minutes or so, and there we go. Thank you very much, and over to Thomas.
Thank you so much, Colin. Thank you, colleagues, for making this possible. Let me share my presentation. So you should have my slides up. So first, really thank you so much. Welcome to my house. I fully agree with Colin that it's it's an interesting time for us to be discussing. We are, a lot of us, I think, are very deeply involved in the response to COVID-19. I am here based in Dakar, Senegal, trying to do my best to support the government to articulate their response. And I'm very thankful for this opportunity to reconnect to really important topics that used to be our bread and butter just a few weeks ago, and start making linkages. Because as involved as we are in the day-to-day emergency, I think it's really critical to to pause and reflect on all the things we've been working on in the past, say, a few years actually, and see how they're relevant to the current crisis. So I will offer some thoughts on those relationships at the end of my presentation, but I will first offer an overview of what we've been doing with governments in the Sahel to promote productive inclusion through safety net programs. What I will be presenting today is corresponds to work carried out by a very large team of people at the regional level, at the country level, primarily at the government level. A lot of government partners and ministries and agencies have been very involved in carrying out these programs, but also on the side of the World Bank and on the side of many partners that I will present, who really came together as one team to support governments and make this work possible. So I will briefly discuss and present the challenge that we had at the outset of this activity around how to boost productive inclusion in the Sahel. I will be presenting the initial phase of the program, which was primarily about having a sound diagnostics of the main constraints that needed to be tackled, and going into the design of a productive package that could be delivered to safety net beneficiaries. I will present the package, the different components of the productive inclusion package, say a few words about implementation, how it went, and the types of delivery arrangements that were put in place to make sure services could actually be delivered in good order. And then I will offer some lessons. As of now, we're at the point now where most of the operational work it has concluded or is about to conclude in those countries, and where we can reflect a little bit on this experience and offer this for brainstorming to the larger community. And of course, as part of that, I will be talking a little bit about the COVID-19 outbreak and what these programs can do to help. So the first question is, why were we asked as a development partner to help support productive inclusion or economic inclusion in the Sahel? There is, as most of you probably know, there is two main reasons for this. The first one, which is the primary reason in the Sahel, is around the notion of resilience and the capacity of households to withstand shocks. And here we're mostly talking about climatic shocks, essentially droughts and food insecurity. And there is, to boost resilience to shocks, there is different levels. There is a large program level angle, which is about creating the capacity for programs to respond quickly, scale up in response to shocks, and make social assistance readily available in a rapid manner to vulnerable people. There's a community level angle, which is about fostering inclusion and positive group dynamics at the community level, so that communities themselves are better able to cope with adverse shocks. And then there is a beneficiary level, which is the one we'll be mostly talking about today, with the community level too, but mostly at the beneficiary level, around boosting productivity and helping households to diversify income sources. So these three levels are the core components of the adaptive social protection agenda, which is really the anchor for this entire program in the Sahel, and that includes these different dimensions. A second reason to care about economic inclusion is about poverty reduction and making sure that poverty reduction is sustainable. There is a concern for everyone involved in social protection and governments in particular to make sure that social assistance has impacts that are long-lasting, that are sustained over time, and that programs not only support consumption, but also promote the capacity of households to generate their own income and have employment that allows them to make a living for themselves. And so we are here operating in this space between social protection and employment or jobs, where we try to both support day-to-day consumption, but also allow people to make progress in their economic activities and try to attain better employment outcomes. So with this in mind, the question that was asked to the teams was, how can we help governments help raise productivity of households, help them diversify economic activities, foster inclusion at the community level, and empower beneficiaries and women in particular to carry out successful economic activities. We don't start from scratch. The Sahel countries, like most African countries, have experienced a massive increase in safety net coverage in the past decade or so, which provide a platform to reach the poor, deliver consumption support, and also deliver accompanying measures that can be added to the basic consumption support packages that safety nets may provide. We know that safety nets in themselves already increase household resilience. There is literature to show that households that have been receiving consumption support over a certain period of time are in a better position to withstand shocks when they happen. And they are also well equipped by themselves to have impacts on productivity and income generating activities. For example, regular predictable cash transfers have impacts on the productive capacity of households and on their capacity to accumulate productive assets and to generate income. But we also have evidence that safety nets can be enhanced to further boost productivity of households and their inclusion into the economic activities at the community level. There is literature and work on cash plus programs that integrates cash transfers and other activities that show promise. And there is very promising evidence from integrated or multifaceted approaches that integrate many dimensions of support at the same time to tackle various constraints that households may face. There was, as most of you know probably, a multi-country impact evaluation that was published in 2015 that showed that the BRAC graduation model, which is this multi-dimensional support package, had strong and lasting impacts on households, at least in countries where it was well implemented. And so that provides us with some guidance on where to look. And so based on this, the question I think is, the evidence we have is that poor households do face multiple constraints to economic activities, and that tackling them simultaneously has the greatest impact. And the challenge is how to do this at scale in a way that is affordable for governments and practical in terms of logistics. So all this has to start necessarily with sound diagnostics, and one of the big lines of work that we opened at the beginning of this program was to reach out to governments and other partners to ask the question: what are the key constraints to productivity and resilience, to make sure we do address the right constraints. So in 2016, there was a phase of diagnostics that took two forms. We had a range of qualitative studies that were carried out with the help of local researchers on a range of sites that you can see on this little map to the left. And there was a set of survey-based constraints assessments that we worked on with our partner Innovations for Poverty Action, IPA. Based on the evidence that came out of these two sets of studies, we carried out consultations and had a big regional design workshop in October 2016 with government delegations to really put our heads together and decide collectively what are the main challenges for households that we can help with as governments, and from this move on to the design of the productive package. So there was a consensus that was reached on those main constraints, which may not sound so surprising, but the prioritization is key. Everything is a problem in very difficult environments, and so it's important to really narrow down the set of constraints one wants to tackle. And so here, the issues of poor access to capital, including financial inclusion, the lack of business skills, the pressure of social and gender norms, especially for women and younger people, and the limited access to market stood out as the main constraints that needed to be addressed.
Thomas, I'll give you a generous 15 minutes, okay? Just to keep track on time. I won't interrupt you again. Thanks.
Yes. To move into the design phase, we had to partner with various organizations to help us. First with Trickle-up, who has a great experience in savings facilitation and coaching. Then with Sesame, which is a training firm based in Benin that supported the design and the thinking around training. Then with researchers, especially on the psychosocial component of the package, and with IPA on the whole learning agenda, which I'm not going to be able to talk much about today for the sake of time, but which is a very important component of this work. So quickly, the package that was implemented in 4 different Sahel countries is as follows. So the basis is that all participants are safety net beneficiaries, so they do receive monthly or quarterly transfers. On top of that, a first activity is about forming groups and providing coaching. Groups are about 15 to 25 beneficiaries. Coaching is delivered both at the group level and at the beneficiary level, and it's carried out by community volunteers or social workers, depending on the country. And I will go back in a little more details on the different delivery arrangements that were used in the different countries. The second piece is community sensitization on aspirations and social norms. This component took the form of the screening of a short video that showed a little fictional but very realistic story of how a married couple overcomes tensions, both within the couple and with the community, and works together to diversify their livelihoods with support from the community. After this screening, there was a facilitated discussion on gender roles, innovation, community dynamics that was delivered by NGOs and facilitators that could be NGO workers or social workers. The third piece was savings group facilitation. Here, there was the formation and the facilitation of Village Savings and Loans Association, VSLAs, that provided a saving mechanism and a mechanism to also provide loans to beneficiaries. The Trickle-up developed the content and did the initial training, and then the facilitation of weekly sessions was done by community volunteers or social workers. The fourth component is a life skills training, 3 to 7 half days, tackling issues around gender relations, communication skills, risk-taking, and that was generally done through private training firms, and in some cases by social workers and NGO workers. The fifth component is a micro-entrepreneurship training that was conveying fundamental skills on micro-business management. Was meant to be relevant for all kinds of activities, both agricultural and non-agricultural, and that was provided by private training firms in all countries. The sixth component, which is the main cost driver, is the cash grants. It was a one-off transfer in cash delivered to all participants. And it was mostly delivered in cash and sometimes, like in Senegal, through mobile payments. This kind of replaces the asset transfer, which was the model in NGO programs, with the idea that cash is more versatile, can be used for a greater diversity of purposes and to support a range of different economic activities. And then finally, there was a small component to support access to markets and help households do group buying of inputs and also think about how and when to sell their outputs. And that was primarily provided by coaches. So this whole package was implemented as in the different sites that are shown on the map and for the number of households that you see on the table. So it was more than 50,000 households that received this package across the four participating countries. So those are Mauritania, Senegal, Burkina Faso, and Niger. Mali and Chad also had productive accompanying measures, but that were a little different, a little more specific to the country. So this is large coverage, and that really tells us a lot about how scalable those programs can be. One important thing to notice is that Senegal implemented this program in urban areas. So it was Dakar and other big cities, whereas other countries worked primarily in rural areas. And so there is interesting differences here that we can talk about. Implementation took place between September 2017 and pretty much now. With different timelines depending on the country. We'll not go into any detail here, but what we can take away is that activities were delivered in fairly short sequence, spanning about a year or 18 months. There was some flexibility on the exact order of delivery, but the cash injection comes last. Is kind of with other activities leading up to the delivery of cash grants. But still, after cash grant, there was this effort to keep coaching going after cash was delivered to households to try to accompany households into their income generating activities and support their efforts in how they use the grant. So those are just a few pictures to illustrate those activities. This is a community sensitization session in Burkina Faso at night with the entire village gathered around the screen. This is a savings group meeting in Niger. So you can see the blue box, the treasure chest, and the lock box where the savings are kept. This is a life skills training session in Burkina Faso with all our participants and the facilitator in the middle. And this is the grant payment in Senegal. So this is a payment point, and the beneficiary is getting the cash paid out by the payment provider. A few words on the different delivery models. I'm not going to go into details, but this is one model that was used in Niger. So the safety net program, the blue box on top, provides the cash grant directly to beneficiaries through the usual payment systems that are put in place by the safety net program. Then the safety net program contracts training firms or NGOs to provide some specialized components, and those were the training, so both life skills training and micro-entrepreneurship training, and the community sensitization sessions. Then there is a direct involvement of the safety net program to involve community volunteers to do the coaching, savings facilitation, and kind of the core activities for beneficiaries. Now, of course, there is oversight by safety net program staff at the local level. One interesting feature is that beneficiaries were able to elect or select community volunteers that would be their coaches. A second delivery model that was used in half of the sites in Burkina Faso, so 2 out of the 4 provinces in Burkina Faso and in Senegal, has an additional actor, which is in the middle, this NGO that works on delegation of the state of the safety net program to deliver services through their own social workers or through community volunteers. So in the case of Burkina Faso, it was Trickle-up and their partner NGOs at the local level, and Senegal has a bit of the same delivery model. Program staff still oversees of implementation and has the responsibility of contracting and supervising all activities. A third delivery model was the one used in Mauritania and 2 provinces in Burkina, and here it's really mostly contracting out the delivery of the package, except of course the transfer of the cash grants, which is always done through the existing payment systems. And this was used in areas where government itself has lower capacity and where the most efficient way to go was to have NGOs. So we can discuss that in detail, but the main message I think here is that delivery arrangements are flexible, and there's different arrangements that can be found to deliver those services. So let me move to the early lessons we have to offer at this point. So the first key message, which made us very happy, is that activities were actually delivered as they were planned. We set up, or we supported governments in setting up very robust M&E systems across the 4 participating countries. And we have initial data coming in saying that basically VSLA meetings took place almost at the frequency that they were planned, with very high attendance rates. There was very high attendance to group coaching meetings, very high attendance to trainings. So most of the M&E data that we are collecting shows that the programs could be delivered, and it was possible through safety net programs, provided that there is some flexibility in the delivery arrangements. And that's the second message. Those delivery models can be adapted depending on the state capacity at the local level, and they can be adjusted to the structure of the safety net program and whether or not the safety net programs already have staff or infrastructure that can be leveraged to deliver the services. The third message is that the cost is more or less reasonable. I mean, it will be up to anyone to make their judgment on this. We are about at $300 per beneficiary with country variations. It costs between $200 and $400 per beneficiary, depending on countries. Those data are still being collected. The cost structure is pretty similar from what we have. So the cash grants represent about 2/3 of the package. There is about a 10% management cost. Saving and coaching are very cheap, mostly delivered at the grassroots through community volunteers or social workers. And the training components, which are a little more specialized, account for about 20 to 25% of the package. And this is about equivalent to 1 or 2 years of regular cash transfers. The next lesson is that coaching is critical, but quality varies. So coaching is generally seen as the component that ties it all together, that makes the package be coherent. In Niger, for example, groups, even 6 or 12 months after the end of the program, groups kept paying coaches to perform their tasks after the end of the program. But there was big variations in the profile of coaches. Some coaches were very experienced, some were not, some were literate, some were not. There were men and women, and there seems to be variation in the quality of coaching that was delivered and the understanding of what coaching actually is relative to savings facilitation and other types of activities. So this is something that I'm sure Trickle-up will be happy to comment on, but that is a critical but also challenging part of the program. And another lesson is that women seem to be very empowered by this program. Evidence is still anecdotal, but it's overwhelming. Women have a spike in agency. VSLAs themselves create a safe space. They foster group dynamics and peer learning with these weekly meetings where beneficiaries who are really almost exclusively women in most of these countries get together and have an opportunity to share and have common interest in helping one another out, because that also goes to the common pot. And it seems that psychosocial components around the community sensitization or life skills trainings were helpful to strengthen community support and foster women's empowerment. And then another lesson is that sequencing matters. So as I was showing you in the timeline of implementation, the exact order of activities may vary, but it seems important to keep the full program condensed and delivered in relatively condensed time frame. And it's important to try to align it with the agricultural season so that the cash injection comes at a time where it's actually useful for beneficiaries. There will be much more learning coming out, and this is my last slide before going to some reflections on COVID-19. I'm not going to go into this in any level of detail, but there is a large-scale impact evaluation that is being carried out as part of this program to test 3 different variations of the package. A social package, that have the core activities and psychosocial support, a capital package with core activities plus the grants, and then the full package. It's a large sample. We're going to look at mostly consumption and food security for households, but also their earnings and economic diversification and their mental health. We'll have 2 waves of follow-up to see how sustained impact seems to be over time. And the first results will be coming out of Niger and be available very soon, in the next few months, and so we'll be very happy to share those results. They seem promising, very promising. Results from other countries will be available in 2021. So that will be a big part of the learning that is still coming up. So let me offer just a few reflections tying back to what is on front and center in everybody's mind these days. the first point I think that is very clear on the COVID-19 crisis is that having well-established safety nets is a critical asset for governments in case of an emergency. And productive inclusion programs strengthen the delivery platform of safety nets. You have groups that are formed that are used to being together, to which messages can be delivered, where group dynamics is functional, that you have payment systems that are equipped to handle big payments of large grants that can also be used for big emergency transfers. You know, the delivery system components help respond to an emergency like the one we're experiencing now. Second, the fostering resilience at the level clearly helps cope with the one we're facing now. Financial inclusion and group dynamics is important with household level health shocks. And when you have a community that can support you, that when you have mechanisms to access emergency lending from you, that can help if your household is struck by the disease. If you think of the broader economic impact of a crisis like this, clearly having a diverse portfolio of economic activities is important. You can see that the COVID crisis impacts economic sectors differently, as you know, agriculture, transportation, commerce, all of them will be impacted, but you know, differently at different levels of intensity and in a different sequence. And so for households or a community to have a range of options is really important, and this is what productive inclusion tries to promote. Greater resilience to food insecurity will be very important if, as you know, most of us are concerned, are worried about, the COVID crisis translates into price hikes or shortages of main staples. So if we do have impacts on, you know, households' capacity to put food on their plates in a normal year, that will be very important when there is a big economic downturn like what we have now. Finally, two final reflections. The social dimension of productive inclusion matters. Better cohesion at the community level will help cope with the crisis. There is fears of social tensions emerging from the crisis, and so better social dynamics will be important. And finally, I think this is something that Pauline alluded to, as we are all turning or you know, trying to wrap our heads around what will be coming next after the crisis. One may think that productive inclusion activities can be a central modality of recovery strategies. So, you know, if you ask the question, what does a stimulus package look like for the poor in the Sahel, you know, like the US or the European countries are thinking of, productive inclusion activities can be the response. You have to provide cash injections to the most vulnerable people and accompany it with productive accompanying measures to stimulate the local economy and create a better, higher level of activity. And so it's likely that leveraging existing productive inclusion programs or launching productive inclusion programs can be a core instrument for governments in the post-crisis recovery efforts. Thank you so much.
Excuse me. Thomas, fantastic. Thank you very much. And we gave you a little bit of extra time because we asked you to speak about the COVID at the very end. Thank you. Just before passing over to our discussants here, I would like to encourage everybody to keep your questions rolling in onto the chat feature. We're taking a close look at those questions, and I think a lot of us have a very similar question on COVID. What does it all mean? So I would particularly welcome any questions or comments around what you're actually doing or what you're seeing. But after Yéréfolo speaks, I am going to have a couple of questions clustered thematically by program design and implementation. But I would also encourage you all to keep those questions rolling in so we can get the best sense of the room. Finally, just to remind you, for those who joined a little bit late, look at the chat box, because Corinne has circulated a survey monkey, and we would like to take advantage of this webinar series for you to complete the survey monkey, to share thoughts on what COVID-19 means for you from whichever perspective you're sitting at the moment. So Yéréfolo, over to you. We'll give you a generous 5 minutes, but we'll self-destruct you after 7 or 8. Thank you.
Thank you, Collins. Thank you, Thomas, for this overview presentation. Trickle-up was really happy to be part of this program, and I'm going to tell you why. Primarily, how do we build this partnership with the Sahel program? Before the Sahel program, we tested 2 different approaches on coaching in the Sahel to learn from this small-scale experimentation with 425 women. And after the learning, we decided now to experiment it on a larger program, government program specifically. And so that was the reason why we got in touch with Burkina Faso safety net project named Burkina Faso, and which led us to meeting the World Bank team in charge of designing the Sahel program. We were also fortunate to participate in the design workshop Thomas mentioned in Dakar. And we also had a donor who is really happy to support us so that we can help the implementing countries or actors in the Sahel program. And also, we were happy to be proposing the training modules as requested by the ASP regional team. Now, beyond that, what has been our role so far in the implementation of the program? We have done trainer training on VSLA and coaching in Niger, Senegal, and Burkina Faso. We also did the direct training on coaching in Mauritania and Chad. Thomas mentioned, didn't mention much Chad, but Chad, as he said, has a limited number of productive measures. So they requested our support and we provided the training. We did post-training visits and refreshing training based on the gaps we found on the implementation of the BSLA and coaching approaches. We are co-implementing in Burkina Faso. I say we are because we have not yet closed in Burkina Faso. We are supposed to close in this June, but that is still a matter of subject to discussion on COVID-19. We have designed the learning agenda for ASP, which is about qualitative evaluation of the program or process evaluation of the program to learn what has gone well, what has to be changed next time, what are the key lessons we are drawing from this program. I will come back to this later. Now, what were some of the differences we have noticed in the implementing countries, the target countries? Some Thomas mentioned it. Niger, Burkina Faso, Mauritania, and Chad are in rural areas while Senegal is on urban. There was direct implementation for social safety net teams in Niger, but NGOs are involved in the other countries. Use of NGO staff as coaches in Mauritania and Chad, but community coaches were used in Niger, but NGO staff were also used to do part of the coaching in Senegal. Number of productive measures varied. The total number, as Thomas mentioned, we have 7 productive measures, but Niger and Burkina were the only one who implemented the 7 package, the measures. Senegal, Mauritania had 6, and Chad had 5. The number of beneficiaries varied from country to country, and that goes from 2,000 in Mauritania up to 17,000 in Burkina Faso. We have done some adaptations in this program to fit with it, and these adaptations started with looking at the training materials, ensuring that the initial VSLA model can be adapted to the cash transfer beneficiaries. So we also looked at the particular country level, how are they calling their field agents to make sure that when the materials come, they will find themselves in, they will easily understand it, and how to facilitate the training sessions based on the education level of the participant, because the levels varied, as Soma mentioned, from illiterate coaches to well-educated people. So also, we did some changes to the saving model based on the time allocated in Chad. BSLA was not adequate for the Chad, so we proposed a table banking. What worked well in this partnership for us? We thought that running the training sessions and refreshing training sessions worked very well in all countries. We had to support learning agenda in the 4 countries. I mean, the learning agenda on the qualitative evaluation of a program is going on in Senegal, Mauritania, Niger, and Burkina. Chad is not part of this process, as it had a very short program. What are some of the challenges? Coordination between with country teams. How do we make sure that agreed timing for the various training can take place at the right time? That was really challenging. We had to keep in touch very regularly with them to make sure that changes are taken into consideration to reschedule the trainings. Training language for some of it was challenging. We were training in French, but in Mauritania particularly, we had some challenges with some participants who don't have any French education. We had some issues around understanding and using the coaching materials which were proposed, mainly for some of the illiterate coaches. Thomas just mentioned some aspect of this. But for this to end my notes, I wanted to highlight some of the key lessons we learned from this program during the implementation phase, knowing that the process evaluation will generate much more lessons, but some of the key lessons we mention is are like the training of coaches must be carried out within a reasonable time after the trainer training. If really you waste time on after the trainer training, some of the trainers might start forgetting some of the knowledge. And the post-training monitoring or visits on VSLA should be held in the first weeks of implementation in order to consolidate the performance of actors, trainers, coaches, and to reinforce the development of the VSLA. And the daily evaluation during the training workshops, doing daily evaluation really were very fundamental to us, because that helped us address on the way the gaps we were identifying in the evaluations. And the last thing I wanted to mention is really the training on cascade. We started with the training model of cascading the training from trainer to coaches, but we realized that it is not effective in all countries. So we changed in Chad. We, instead of doing in cascade, we went straight away and trained the coaches and went directly with them to start implementation. There was no time, to let them implement and come back later. Now, regarding COVID-19, yes, Colin? Just a few minutes on COVID-19.
Can you take a couple of minutes so we can get into some Q&A? Thank you very much.
Yeah. Thank you very much for that. In Burkina particularly, we are on shutdown for all towns which are affected or which has affected people. And so the country is going through a curfew from 7 p.m. to 5 a.m. So it's already creating some of the problems because the markets are closed. So issues are there with security forces between businessmen and security forces, mainly those who are in the informal sector. And that is a big concern to us, because most of our program beneficiaries are in rural areas, and the markets being closed can be an issue for them to sell their products for those who are going to market to buy or sell their products. Thank you, Colin.
Thank you so much. I appreciate that. So just a couple of words to step back and some perspectives from the PEI before going into questions. I think we'd like to get these questions and answers organized in a way that asks, what does this mean for other countries? What are some of the global lessons that we can take out of this? And by way of a little advertisements, I think this session brings up many detailed questions. In the coming months, the PEI will be launching a State of Economic Inclusion report, which tackles many of the issues, controversies, and dilemmas around scaling up economic inclusion. We are in the middle of finalizing this and sending it to a pre-editor at the moment. But stay tuned for this, and perhaps one of the next sessions on sp.org will be around some of the key background materials that we've been learning from this report. Also a reminder, dig into the SurveyMonkey if you haven't done so already. So we'll organize this Q&A in 3 blocks. I think the first block will be big picture design questions. The second block will be some of the nitty-gritty implementation and delivery questions. And then we'll return back to a final set of considerations on the COVID-19 response. But in terms of the big, and there's many questions coming in, so we can't answer all of them. But in terms of the three big blocks of questions that I would like to circle back to you on, let me give you these for consideration. They really touch upon beneficiary selection, costs, and context. So in terms of beneficiary selection, we have lots of questions coming up in the chat box. How did you do beneficiary selection in the first place? How did this depend on the objectives of your program in terms of if you were targeting beneficiaries who are safety net beneficiaries or beneficiaries who could be doing something a little bit more like entrepreneurship? How did you approach issues of female participation and the role of women? How did that go? How did that factor into beneficiary selection? And were there any unintended consequences of the engagement with women on these programs? We hear so much about, for example, GBV and all of these other contexts and considerations, intra-household challenges when it comes to beneficiary selection. So there's a whole range of questions there around just how did you get beneficiaries, particularly when these programs are small, more expensive, and maybe not universalized. And that came from numerous people. David Panetta and then Kingsley Atten then focused in on costs, and often the issue of costs is really quite central in these discussions. So you've put out a figure there which looks relatively, a sticker price looks relatively cheaper compared to some other interventions that we've seen coming out from the graduation programs. How do you get to that point? Is that sticker price transferable? Is that sticker price in any way misleading? And when you look at all of these costs for different types of delivery mechanisms, what actually gets into the hands of a beneficiary at the end of the day? And then a context question for you, Thomas, which was just on the rural and urban side of things. There was 1 or 2 questions coming in around what does this imply for urban space? What are we learning on access to markets? So I've given you a lot of information there. I'm going to give you maybe 6 minutes or so just to see what you think on any one of those questions. And Yéréfolo, I'm going to come back to you if you have any thoughts on those issues. But just talk us through big picture. How do you select beneficiaries? What was surprising? What was new? What's coming up in the rural urban space? And this question of costs, how do we do better on that? And I know PEI report will have some answers on that too. Thank you.
All right, no, thank you so much for these questions. Very important questions. So the selection of beneficiaries really piggybacked on the existing apparatus of the cash transfer program in most of these countries. So So we have a number of, the households receive regular cash transfers, and they generally have one person that is the one receiving the cash transfer for the rest of the household. In most countries, the government decided to just stick with that person. And that person happened generally to be the woman, or even or always to be the woman in some countries. For example, in Niger, the recipient of the cash transfer was the woman, the wife, one of the wives of the head of the household, and that woman was selected to participate in the productive inclusion package. So we ended up having women-only beneficiaries. In other countries, like in Mauritania or in Senegal, there was a slightly more complex process to identify the recipient, because governments were concerned that beneficiaries of the productive package should be at working age and should be, at the time of their lives where they are productive. And so if the recipient of the cash transfer was above 60, for example, or even sometimes 45 or 50, then it should be the older daughter or the next oldest woman in the household that was selected. And if there was no one available, then it would be the next man. So there was a bit of a decision tree there that prioritized having women and who were able-bodied and able to carry out economic activities. So there were variations across countries, and there can be even more. I'm working in Nigeria, where the selection rule is more complex and gives more flexibility to the household itself to select whoever they want from them to participate in the productive activities. But in the Sahel, it was really mostly geared toward women. We did not so far see adverse impacts. We are thoroughly measuring this question of cohesion and empowerment in the impact evaluation and in the process evaluation. But going in, that was a big concern, and this is one of the reasons why all these activities around community sensitization, this efforts to rally husbands and older people and village heads and leaders around the objective of the program and around the beneficiaries, all this was put in place for this purpose. And I could go back in more details into what went into the psychosocial component, but creating a supporting and enabling environment for women, for kind of disempowered women to thrive and to make progress in their agency and in their innovation. That was a very big focus in the design, and this is one of the things we'll be measuring directly in the impact evaluation. On costs, yes, we were happy to see where we ended. Going in, we did some rough costing calculation. We were about in this ballpark, but it got confirmed on the ground. There's different elements, I think, to this. One is that it really builds on an existing system. So we're not starting, governments did not have to create payment systems or decentralized program staff or any of these things. That was already there, and it's not factored in the costs that I showed you. This is the additional cost of setting up a productive inclusion program onto safety nets program, and so it doesn't take into account what was already there. And it's really critical to think this way, because it's really testimony of what safety net programs offer in terms of a relevant and cost-effective platform to deliver additional services. So that's one thing that clearly differentiates this program from other NGO-led programs that had to start everything from scratch. Another, I think, important component was the use of community volunteers in most countries, who did get some form of compensation, but much less than social workers would get, or government staff would get. And the rationale behind this was twofold. One was to make sure that coaching and the accompaniment was relevant and context specific. So who better than a community member to actually provide these insights and help in a way that is relevant to the beneficiaries' lives. And the second was to make sure it was scalable, and that it was not too expensive, and that it could be implemented at a large scale. I think this is why some of the components around coaching and savings group facilitation end up being much cheaper than what you find in other programs. I think that the scale itself matters. So the costs that went into program development, which are accounted for in the numbers I showed you, are diluted, or are spread very thin across multiple sites and a large number of beneficiaries. And the fact that we used a regional approach helped a lot, because it's not clear that each country taken separately could have been able to front all the design and development costs at the onset, but going in it together as a regional team, I think, helps the governments deal with these upfront expenses of developing the program. That's it on cost. Let me be clear that the collection of cost data is complex. We're taking it very seriously. We are really bringing in I think the best experts on this, and it's still ongoing. So the numbers I showed you, I showed you a range. We're going to refine them, but the point is really to include program development costs, administration and management costs, and overheads, everything that would go into the cost. On the urban rural differences, there is a lot there. So urban areas present certain challenges, but also certain key opportunities. On the challenges, forming groups and stabilizing groups over time is much trickier. Neighborhoods are less well defined than villages. People don't really necessarily identify to a particular neighborhood. There's more mobility, and so having stable groups over time that create this group dynamics is more challenging. Logistically, it can also be more challenging to find space to deliver training or to get people together. And in general, beneficiaries have less time. They're more busy. Their days are less structured, or there's more to do, and so there is less time to deliver services. On the other hand, you generally have higher levels of capacity, both from the people who deliver the program and from the beneficiaries, and that creates a greater impact of the training components for people. And then there is also a greater access to markets and greater diversity of possible economic activities. And so when the beneficiaries go through these modules on how to select activities, how to look at markets and try to find ideas and do different things, it connects better to their lives, because they can see how diverse and the vast range of opportunities that exist in their immediate surrounding. And so the capacity of the program to actually push people to diversify their economic portfolio is probably greater in urban areas. I'm going to stop here. Those are vast questions.
It's this webinar feature is kind of it really puts you on the spot, Thomas. I'm going to pass over to Yéréfolo if you have some thoughts and considerations on these big issues, and then I'll have 3 questions just on delivery structures. Hello.
Hello. Yeah. Can you hear me?
Go ahead, Yéréfolo, we can hear you.
All right, thank you. On the selection aspect, I just wanted to highlight that this proximine testing methodology was used in all countries, but particularly in Burkina Faso, I wanted to emphasize that it had a community level participation because we had what we call complaint committees in each of the targeted villages, which helped really check the error of inclusions and error of exclusion in the list of potential beneficiaries in this program. And on the urban aspect, Thomas mentioned it, it's really challenging, the VSLAs. And first of all, we changed the name in the context because we cannot continue to call them VSLAs in urban settings. We call them community saving and loan associations, but the principles are the same, and it's really challenging to have them meetings, all of them in the same meeting. Sometimes it's really challenging. But in the opposite of the rural areas, sometimes they buy more shares because they are in areas where their business are well off sometimes, and they can buy more, the more share they want. And the other thing, for rural areas, the challenge sometimes in the first cycle of the BSLA, what we've noticed is that people are not really buying the most shares they could. But it's only after the first cycle that things really kick off. So these are some of the major aspects based on the learning from rural or my own experience based on this program. Thank you.
Thanks, guys. I'm going to keep you all on the spot with 3 questions on delivery mechanisms and implementation. And I'd ask if somebody is on the line, if they could mute. There seems to be a little bit of interference. 3 blocks of questions that are coming up on the chat box are around government capacity. So what's new here is the delivery of all of this through government capacity. So what are the examples, Thomas, of government ownership on this, the incorporation of all of this into a policy space? How does the decentralized service delivery look as well? And then what are the role for other actors to come in behind this? We're dealing in what would appear as quite constrained and low capacity environments. Yéréfolo, you already started us off on the VSLA, which is great because there's a lot of questions coming in on the VSLA on the chat box, and you might take a look at some of those questions coming in. So on one hand, how do we leverage the VSLAs better? On the other hand, are these models in any way sustainable? At the same time, how do the savings mechanisms work? Is it for kind of a community, or is it just for women only? And I suppose, are there any unintended consequences of using all of these VSLA approaches? And I think there was a really great question from somebody who looked at the community volunteers, and Thomas, you already touched upon this, but I think one of the questions was coming in really to ask, how is this truly sustainable? And also, how do you do it in a way that typically when you're engaging with excluded groups who may not really be part of a community structure at times, how do you make this work in a way that isn't coerced or isn't forced and is genuine community volunteership? There are lots of other questions coming in. We will make this PowerPoint available. I'm sure Thomas and Yéréfolo and myself will be available for email follow-ups and questions and answers after that. But let me just try to condense those questions over to both of the speakers, and then we'll come back in 10 minutes or so to just touch base on the COVID aspects. So talk to us about delivery capacity, VSLAs, and communities. We'll start off over with you, Thomas. Thank you.
Thank you very much, Colin, and thank you to all participants who are asking questions. It's really very stimulating. So on the first question was key. To what extent can we rely and foster government capacity and government ownership around these issues. At the onset, I think everybody realized that this would be a challenge, but it was a challenge worth trying. And so everything that I showed you was thought of, including within governments, as a pilot. You know, we're going to try it out and see if it's doable, if we have enough capacity to sustain it over time, and if the assistance that is being provided by the World Bank, by Trickle-up, by other actors can be done away with in the long term, and can be all this expertise can be built from within government. And to be very clear, I think at the beginning, governments found it challenging to set up this kind of multi-dimensional set of activities, and I think it was very important to have these regional partners like Trickle-up or like the World Bank teams to really provide technical assistance in the early phase. And then the whole point was to learn by doing and build the expertise. My take on this right now is that a few years down the line, there is really amazing centers of expertise within each government. It can be a few people within the social safety net programs, and a range of people in the field who have gone through all the process of implementing a package like this and who know how to do it. Right now in Niger, in Senegal, in Mauritania, and Burkina, and the other countries as well, you have the top experts in implementing packages like this, and this is being reflected in scale-up plans. Most of these countries are now thinking of productive inclusion activities as a key component of their strategy moving forward on let's say 3 different levels. One is scaling up what was done. It was like 10, 15,000 households. It can be scaled up a lot. Senegal, for example, is massively scaling up, or will massively scale up towards rural areas, and confidently so. The second is to think of it as a potential tool for exit strategies of safety net beneficiaries. This is something that Senegal is thinking of. This is something that Mauritania is thinking of as well, to really put safety net beneficiaries on a path toward being more autonomous and having a greater capacity to live themselves, or to keep the positive trajectory out of poverty. And a third angle of scale up is around youth employment programs, or employment programs in general. This forms a core set of activities that can very well be used to promote employment for the very poor. And Niger has started a youth employment program based on a set of productive accompanying measures. Mauritania is about to do the same. Senegal is using some of the strategy in its own youth employment strategy, and Burkina is also gearing up in that direction. So the government ownership and capacity was not necessarily there at the very beginning, although the interest was. But I think we're now in a position where those programs can be scaled up and put at the center of some of the key social protection strategies that governments have. I'll let Yéréfolo talk about the VSLAs. He's really the expert on this. And let me very briefly talk about the community volunteers. It's very much a question. How is it sustainable, and how does it compare to having NGO workers do the same set of tasks? We will really look into this with a very open mind through the process and impact evaluation. But the early results that we have, or the early evidence that we have from Niger, so 6 to 12 months after the end of the program, is that beneficiaries are so pleased with what they get from their community volunteers that they keep paying them out of their own pockets through the VSLA groups, so that they perform the activities that they used to, so facilitating savings, providing some group coaching, and helping them access markets. So it seems sustainable if the group dynamics is positive and is supportive, but this is clearly a kind of an innovation that we'll look at very candidly when we draw all the lessons. I think on the question that how to make sure they are actually volunteers, this is where having the program staff be there and have a clear protocol for how these volunteers are selected, and this whole needs to be organized and structured to make sure that there is no issue like the one that is implied in this question. But that is a very important point that I'm sure can be addressed operationally. I'll leave it there.
Thank you, Thomas. Yéréfolo, especially on the VSLA, and I know there was a couple of coaching questions that come in as well, but a couple of minutes over to you, please.
Thank you. The VSLAs, as I said in my introductory notes, are a model we adapted to the program to suit the program. And so, but we kept the fundamental elements of the VSLA approach, which is well known by all those who are in the VSLA sector. And also, one thing someone asked about sustainability. One thing that we noticed is that in Niger, for example, the program is closed, and as Thomas is saying, the groups are still operating. And even if some of them are requesting support from the community volunteers, but the groups are still there, and that is really a very good foundation for strengthening whatever new program or existing programs in the communities. They are there, they are operating, they are still collecting their savings and distributing loans and going through their cycles they agree to do. The other thing I want to say is that the volunteers are, as Thomas said, are selected from by the communities. So they are staying in their communities. They are from the same communities where they work. So this idea of having the community volunteers came from our assessment of the ratio number of beneficiary per field agent. We realize that some of them have even about 500, sometimes more than 500 beneficiaries. And doing coaching for this number of people is not really realistic. So we proposed to have community volunteers who will take up the coaching role with the support from the field agents. So the community coaches are not, volunteers are not on their own. They are being trained and supported, supervised by qualified people who know well the coaching approach and who can support them even in the VSLA approach. So they are not on their own. They are receiving support. And the sustainability of this community volunteers is also a big question. We are, through the learning agenda, we will be assessing this mechanism, what keeps the community volunteer in the community even after the program, and what is not motivating him, or what do we need to have in place to motivate him more so he can continue doing his work. Then one of the key aspects to consider is if the community coach can get any incentive from the participant, the beneficiaries, I think he's going to continue to provide the support. And I think in the arrangement in Niger was that the program provide half of the incentive, and the groups also contribute to the incentives. So that mechanism was kind of creating the foundation for any kind of durable, sustainable relationship between the community coach and the groups. That's not the case in Burkina Faso, but we are currently designing a mechanism. I mean, how do we make sure that the community volunteers keep working in the communities and beyond the communities, depending on the request on them? That's based on the model we have seen on the VSLA original version, that some of the facilitators continue facilitate and they don't rely on any external support. So this idea is fundamental here. We bring it to the community volunteers, and then we share with them and ask them to go beyond the current villages. But during the program implementation, that was not possible because we wanted to make sure that we have a good control of where we are implementing to avoid contamination in the different research the program was aiming to implement. Now that the program has come to an end, that possibility is there, and it's a very good opportunity for some of the community coaches. Allow me, Colin, to say a word on the youth aspect. Some participants.
I'm going to give you 30 seconds because I want to use the last 10 minutes.
I wanted just to say that most of these community coaches are youth. They are young men and women. Thank you.
5 seconds. Okay. Terrific. I mean, it's just a whole watch this space area of innovation and adaptation. I think any one of these questions could be a whole seminar workshop in and of itself. So thank you. I would like to maybe give a further plug. My role as making commercials. In the State of the Economic Inclusion report that will come out, we have a full case study on the Sahel program, which goes into many more details in a very accessible way. And we've also undertaken a full costing exercise across, I think, 35 countries at this stage, looking at how economic inclusion programs through different pathways are costed and what we're learning. But now let's take the very last 5 minutes of this phone call to talk a little bit about COVID. I think we have about 45 survey responses, so I want to thank everybody who's actually completed the Survey Monkey. We'll keep the Survey Monkey open for the rest of the day. So if you want to go into that, we would like you to do it. And if you want to forward it to some friends and family, go right ahead. But on the COVID, we've had a couple of questions. Thanks to Anna McCord, Kate McKee, Marku Malkamaki. And the questions are rather similar, but I'm going to break them down very easily for our two panelists. I'm going to ask you to have a crystal ball. I'm just going to ask you to take 1 or 2 minutes each to tell us two things. Tell us on the ground, if you can think of one particular program that you're working on at the moment, whether it's in Burkina Faso or whether it's in Senegal, here and now, what's actually happening? What's the discussion like? Has it started to happen yet? Is it going to be taking place in the next 1 week, 2 weeks? I think Yéréfolo, you already said that. So what is immediately happening under your programs at the moment? Are programs being stopped? Are benefits being blocked? And then the next question is 6 months from now, 9 months from now, in a scenario where we think that COVID-19 subsides, where are we going to be? Where is the discussion on economic inclusion in your country of choice going to be? So Yéréfolo, let me start off with, can I start off with you to give Thomas a little bit of a break? And then pass over to Thomas, if you have just any closing considerations for the group.
Well, thank you, Collins, on this COVID-19 thing. I shall say that we are, my team and myself, we are all working remotely from our homes, and our partners are now also kind of doing the same, because out of the 3 partner NGOs in this program in the north of Burkina Faso, one had still its field staff going on the ground to support the participants to develop their livelihood plans. And the other 2 had called their teams in office. So one, they are working from the office. But the connection, they are still in touch with the coaches and the president of the VSLAs by phone, and so addressing the needs by phone. So this is what really is going on now in this program, what is being discussed. The most discussions are focused on how do we finalize these livelihood plans for all VSLAs. We are kind of halfway on developing the plans. Some communities have done, but some are still struggling to finalize their plans. And that will take us almost a month or 2 again for some of the communities. So this COVID period is going to really to slow down things here, and we are a bit concerned because we are expecting to close the program in June, but that is again a matter of discussion with the key stakeholders to see if there is any possibility of extending the program to allow us to really finalize some of these key activities. So yes, 9 months, 12 months down the line, what will be discussed or regarding COVID, we are expecting that this crisis by then can be really finished. And also we are expecting by then we will be finished with field level implementation of this program, but now assessing the various learning from this, because I shall say that this program has generated a lot of learning, and we need to find time to concentrate and draw the key lessons and for sharing, because we do expect that there is potential for scaling this program, but before we can go for scaling, we need really to draw all the lessons. What is working, what is not working, what do we need to do differently next time? That's really fundamental, I believe, and that's we need to provide time for it. Thank you.
Thanks so much. Thomas, last words to you.
Thank you very much. There's a lot of discussion going on in Senegal, like in all countries, on the response, and the safety net program is really front and center in the government's mind as a key tool for responding. There is in Senegal a very large register of poor households in the country, and a very large also cash transfer program, which are currently in the process of being leveraged to have a pretty sizable response in cash transfers beyond the existing cash transfer program. It's really a scale up of cash transfers as an emergency response. A big debate that is ongoing now is on the articulation between a response in cash and a response in food distribution, and how these two intersect, how they can be used in a complementary way and in a sequenced way, knowing that in Senegal, like in other Sahel countries, there will be a large number of households in food insecurity starting in May, June. And so this is, everybody's worried about a perfect storm coming up. The only thing missing is the locusts that are making their ways from East Africa. And so we may be in a situation a few months from now where we really need to use all the levers, like all the instruments of social assistance through cash, food, and on the ground facilitation to help households cope with the outbreak. In terms of the field activities, of course, they stopped, but they will resume with all the sanitary and the health guidelines being respected, so that there is still the capacity to target and reach out to beneficiaries and provide basic services and basic transfers, be it in cash or in food. It's a long story, but this is where the discussion is. If we project ourselves after the crisis, whenever that is, I think it will become crystal clear for whoever was not convinced that having large-scale social registries and payment systems is really critical to prepare for any emergency or any crisis like the one we just had. And there will be, I think, very important comparisons to be drawn at the global level between countries that had a functional safety net system and between countries that did not have, and their capacity to react rapidly and efficiently to a crisis like this one. I think all countries should be ready, and all the development partners should be ready to support a massive enhancement of social protection systems, because it will get even higher on government's agenda. as I was mentioning in my remarks, I think that productive inclusion and fostering economic activities among the poor will be high on the agenda as well. There will be, I think, at least in the countries I know, the willingness to provide direct support through cash or through other services, and articulating those in a coherent way, in an intelligent way, like a productive inclusion package does, will be key in ensuring that it is actually successful in helping shore up the households and the economic activities. And then, of course, I think there will be further thoughts put into the links with healthcare and access to primary healthcare as an additional benefit of safety nets. Senegal is already offering universal health coverage for cash transfer beneficiaries, and I expect that there will be more discussions on the readiness of the health system at the local level to provide meaningful services to the poor wherever they live. But of course, this is really my thoughts, and they're worth anybody else's thoughts. Just one word to conclude on my side. Everything that I presented today will be curated and made available to the larger community. It's a big part of the effort that we're doing now at the Sahel level as part of the Sahel Adaptive Social Protection Program. And so the description of the components, the results from the evaluation, some key core operational instruments like operational manuals or even TORs, we're really willing to make this available to anyone or any country, any team that would be interested in learning or adapting our approach in their context. So we're not only open, but eager to make this experience interesting and relevant to anyone, and please do share your suggestions on how to make sure what we did can be used and that people can learn from it to promote productive inclusion in their countries.
Thomas and Yéréfolo, I want to say on behalf of the whole group, a huge thanks, tremendous thanks. This has been a lot of effort to pull off for both of you. We're delighted the connectivity issues worked out. We're a little bit sad we didn't see your cats and your children disrupt the webinar, but congratulations for being truly on lockdown for this hour and a half.
I can open the door.
You can open the door. We'll all be delighted to see what's behind it. And I think it's a very, at least an upbeat message of information sharing and sharing information that's gone on in Sahel. A few quick words of thanks. I mean, well, first to say, let's watch this space and all of these COVID-19 issues and all of the moving parts and all of the complexities. We are doing our homework here at the PEI. We'll be in touch with all of you. Reach out to us if you want to stay engaged in that process. We'll share back some of the survey information that we got. I want to say a massive thanks not only to our speakers, but the behind the stage crew, the backstage crew, to Karine from sp.org, to February from GIZ, to GIZ, and to Janet and Ode, and lots of other people I probably forgot, and Vasu, for bringing all of this together. We will circle back by email with the agenda for the remaining seminar series. And if you have any ideas, thoughts, feedback, do let us know. Have a great day, everybody.
Thank you. Bye.
Thank you very much. Thank you all.
Bye.
Thanks, Thomas. Thanks, Yéréfolo.
Thank you.
Bye.